Have you ever heard of a hearing problem that starts with a really strange paradox? The issue isn't that sound can't get in, it's that one of the tiniest bones in your entire body is basically holding it hostage. Today, we're going to dive into the fascinating condition behind this mystery, otosclerosis. I know, it sounds completely backward, right? Normally, you'd think more noise makes it harder to hear, but for some people, a loud restaurant or a busy street actually makes it easier to understand a conversation. And this bizarre phenomenon, well, it's often the very first clue that something really unique is happening inside their ear. So here's how we're going to break it all down. We'll start with those puzzling first symptoms. Then we'll look at how doctors actually pinpoint the problem. After that, we'll get into what's physically happening to that tiny bone. Then the good part, how you can reclaim that sound. And finally, we'll talk about what life looks like after diagnosis. All right, so let's dive right into that initial puzzle, because honestly, the first signs of this condition can be super confusing for the person who's going through it. So that weird symptom we just talked about, it actually has a name, paracystis willisii. And here's what's going on. When you're in a noisy room, what does everyone do? They talk louder, and that extra volume is just enough to power through the physical blockage in the ear, making speech suddenly seem way clearer than it does in a quiet room. It's a classic sign. And the condition causing all this is called otosclerosis. Really, at its heart, it's a bone remodeling problem. A kind of faulty bone growth starts happening in the middle ear, and it ends up locking down a tiny little bone called the stapes. And when that stapes can't move, it can't vibrate, which means it can't pass the sound along to your inner ear. The sound just stops. Now, one of the most striking things about otosclerosis is who it affects. You can see it's about twice as common in women as it is in men. And that pretty significant difference has led researchers to think that hormones might be playing a pretty big role here, either triggering it or making it move faster. The risk factors paint an even clearer picture. It's most common in Caucasian populations. And get this, it's not a condition of old age. It usually shows up when people are in their 20s, 30s, or 40s. There's also a big genetic link. It definitely runs in families. And, like we just mentioned, hormonal changes, especially from pregnancy, are thought to sometimes kick things into a higher gear. But here's some really important context. Even though we can find microscopic signs of these bone changes in up to 10% of the Caucasian population, only about 0.3% actually develop hearing loss that's bad enough to notice. So for a lot of people, the bone changes are there, but they're totally silent and never cause any trouble. Okay, so if you've got these symptoms, how do doctors figure out for sure that it's otosclerosis and not something else? Well, they've got a very specific set of tools they use to zero in on the exact problem. Let's take a look at their diagnostic toolkit. It's like putting together a puzzle. First up, a hearing test, audiometry, will show a specific kind of hearing loss, often with this little telltale dip at a certain frequency called the Carhart notch. Next, they test how well the eardrum moves, and that usually comes back totally normal, which helps rule other things out. And finally, a test on the stapes reflex to loud sound will show that, well, it isn't moving. You put those three pieces together, and bingo, you've got the classic signature of otosclerosis. So we know how to spot it, but what is actually going on deep inside the ear? What is this overgrowing bone really doing? Probably the best way to picture it is this. Think of that stapes bone as a tiny piston. It's supposed to pump in and out, pushing sound vibrations into the inner ear. Otosclerosis is basically like rust seizing that piston, just freezing it in place so it can't move at all. Let's just walk through the process. It all starts with that weird bone remodeling. A soft, spongy kind of bone filled with blood vessels starts to grow where it shouldn't. Over time, that new bone hardens right around the base of the stapes, cementing it into place. And once that happens, the chain is broken. Sound just can't get through effectively anymore. Now, here's the really good news. Once it's diagnosed, this isn't something you just have to live with. There are some excellent ways to reclaim that lost sound, and it really comes down to a choice for the patient. And this is the big question for most people with otosclerosis. Do you amplify the sound to push past the blockage, or do you go in and surgically fix the blockage itself? The thing is, both are really effective ways to go. So let's compare them. A stapedotomy is this incredibly delicate surgery where they create a tiny hole in the stuck stapes and put in a microscopic little piston to bypass it. The goal is a permanent physical fix. On the other hand, you've got modern hearing aids, which are just fantastic at turning up the volume enough to power through that block. They're totally non-invasive and a great choice for anyone who can't have or just doesn't want surgery. For people who do choose the surgical route, the results are, well, they're often remarkable. The success rate for a first-time stapedotomy is between 80 and 90%. And what they mean by success is getting the hearing back to within 10 decibels of its natural potential. For most people, that's absolutely life-changing. Of course, those aren't the only options. For really mild cases, just watching and waiting with regular hearing tests is a perfectly fine strategy. Some medical therapies have been tried, but honestly, the evidence that they work is pretty limited. And for the most advanced cases, where the otosclerosis has started to damage the inner ear too, a cochlear implant might be the best way forward. So, what does the future hold for someone with an otosclerosis diagnosis? This last part is all about the long-term outlook and some of those key life questions that come up. And the message here is overwhelmingly positive. It doesn't matter if a person chooses hearing aids or surgery. The vast majority can get back to having really functional hearing. This is not a condition that has to limit your engagement with the world. The prognosis for a full, active life is excellent. So let's circle back to that hormone connection because this comes up a lot. What's the deal with pregnancy? We do know that some women who already have otosclerosis say their hearing gets worse during pregnancy. What's less clear is whether pregnancy can actually cause it to start in the first place. So the standard approach isn't to tell women to avoid pregnancy, but to just counsel them on the possibility and keep a close eye on their hearing. At the end of the day, here's the most important takeaway. This is a highly treatable condition. The decision between surgery and hearing aids isn't about one being better. It's about what's best for you, your lifestyle, your comfort level with risk, and what you want for your hearing. It's all about personal choice. And that leaves us with this one last thought. The stapes is one of the smallest bones in the human body, yet a tiny microscopic change to it can completely alter how we experience the world around us. It's just a powerful reminder, isn't it, of how sometimes the biggest consequences can spring from the most minuscule changes.